We've been talking about gender this morning. We mainstream gender, we know the value of gender. No matter how we want to put it, gender is important. If it's not important, we will not be talking about it as we're talking about it today. My name is Chika at Offor. I am a gender advisor. Senior, innocent me, gender advisor. I didn't say I'm coming to fight about gender anything. I'm just advising. Yeah. So let it be on record that I am advising. And the person who is advising is a woman. So we are strategic in our advice. We don't quarrel. We just tell you how we can work together, synergize, and at the end of the day, universal health coverage will cover those you're supposed to cover. Am I lying?
No.
Am I lying? Guess what? There's a secret. If you don't respond, I spend 1 hour. If you respond, I spend 10 minutes and waka. Yam and cutlass is in your hands. We just had lunch. We're feeling cool. I'm feeling heavy. I need to walk around also to release some of the food. Gender equity in primary health care. You know, when we talked about universal health coverage, we talked about basic healthcare provision fund, we talked about insurance, and we talked about the vulnerable groups. And when we talked about the vulnerable groups, we picked out 2 important components of that group. We said women, we said children. Isn't it? So, everything we're talking about is about this important group. We talked about something else, we talked about demand, and we talked about supply. No matter the whole story we're talking about today, if you provide the best primary health care center, everything is working there, and nobody goes to the PHC to do anything, it is a failed project. So, those vulnerable groups, which is why we're talking of basic healthcare provision fund, have to be able to access primary healthcare services and have to be comfortable to access primary healthcare service. My time is going. Next slide, please. What is equity? We talked about equity and equality. We've already showed this slide, but I'm going to explain it in my own way. Some people need more help than others. Lagos State does not, everybody's going to the health facility. People understand that women can be treated by men and men can be treated by women. That's Lagos. Beautiful. Then we talked about some of my communities in Abuja, Damangaza, Fulani community. A woman attends to a woman, a man attends to a man. That is how they grow up. That is what they know. That is what the psyche tells them. Should they be left behind?
No.
Do they deserve to have health care?
Yes.
Are they important?
Yes.
So that is what equity is. So we will help them up. We will do what? Help them up. So we are going to a primary health care center in, for instance, Damangaza and Guamsawa. We are not going to make sure that all the customer frontline workers are all men, and you say you want them to access health. It's not a matter of right or wrong. It's a matter of what is needed at that time. And what is needed is that when she goes to the PHC and she's pregnant, she should be comfortable to access care. Why you keep telling her that over a period of time, it doesn't matter whether it's a man or it's a woman, but at the beginning, she needs to be able to access care, and then we help her. Am I correct?
Yes.
And then her children will survive. Thank you. Next slide, please. So, gender equity, we talked about it, the cornerstone of universal health coverage. It is, because at the end of the day, universal health coverage is about demand and supply. Whether we like it or not, they are husband and wife. Husband and wife. And the primary health care center is their house. Husband and wife must be in the same house. If husband is not there, it will not work. If wife is not there, it will not work. So we have to make the house comfortable enough for both the husband and the wife to stay together. That is what universal health coverage talks about. It's not just about making sure that the PHC is adequate. It has all the things. It has equity. It has everything, which is also very good. But it also has to be about the people accessing the service. They are also important. What is happening in Lagos is very what is happening in Kano. What is happening in Sokoto, very what's happening in Delta. All of them matter. of us together are what? Nigerians. Most importantly. And that should matter. So, let me start with a story. There's these twin girls. Can I put a picture of the twin girls, please? My twin babies. Husseina and Hassana are twin girls from one of my communities. When they were born, I was there. They did not want to access immunization or any form of service because they didn't know better. I convinced them in my organization. We spoke to them, we had fun with them, Husseina, Hassana. And then for 5 years, I was going every month to take them to receive their vaccines, talk to the Mengwa, Mengwa's children, the last wife, the Almaria, had them. And then one day, I got a call that Husseina had died because she was sick. They didn't go to the PHC. The PHC did not have the things that they had. They didn't trust the PHC. As we have been talking since, there's some component that we have not mentioned, and that is trust. Everything in life is based on trust. If you do not trust whatever it is that the government is bringing, you will not access it. You will not care. You don't even believe that they have the capacity. Trust. So they went to the chemists and they were treating them. And they treated, the next thing I heard was Husseina had died. And then they called me. We rushed Hassana to Offor General Hospital. After rushing her there, operation instantly, 5 years old. They said frozen intestine. They said typhoid. They said different kinds of things. But the point is, the primary health care had failed us. Because if it was what it was supposed to be, initially they would have gone there and they would have been sorted out early enough and they would have lived. Which is when we say the vulnerable group, this is them. After 4 operations, they took her to National Hospital. I was there all the way. Hassana died. My twin girls. And guess what? The reason why I say gender is important. Call it out. Don't generalize. Don't say family. Say women. Say mother. Say child. Call it out. These are the only 2 children that Amaria has. But the Mengwa has 28. So who feels the pain? Until today, as we speak, she does not have any more children. What has happened? Universal health coverage did not universally protect us. Because the primary health care center failed us. So when I say call it out, gender is important. Call it out. When you're talking about the health insurance, you say 1.something million families that they are going to cater for so far, and the private sector will support. And then I asked Gombe, where Gombe people were here the last time. I said, how many of them are women? They said maybe like, I think they said 10%. I think they said 10% were women. And then today, my brother who spoke on primary health, the basic health provision fund yesterday, talked about it and said it's family oriented. So if they say it's a man, the man is the head of the family, fine. But suppose they divorce, what happened? So what we want is call out. If in your state you are supposed to have 200,000 people in the insurance scheme, I want to know the disaggregation by gender. How many women? How many men? Don't say the man is in the family so covers. It does not cover. Call my name. Call my name. Call my name. So that if they divorce, if something happens, the world we live in is so dynamic and so unpredictable that you cannot use a blanket way of to do things. You can't just do that. You can't. So when we ask, basic healthcare provision on paper is supposed to take care of the vulnerable. And then we itemize and identify the vulnerable as women and children. Then in the implementation, you say that the men are the ones that has their name written in that folder, in that card, so that they're the ones. What are we talking about? As you have written it down on paper, let it be like that in implementation. So all we're saying, but there's no quarrel. There's nothing. We're just saying call them out. Let us, as we are doing anything we are doing, in what we do, anything we are doing, call it out. Call men, call women, call children. Don't leave anyone behind. That is what basic health education is talking about. Leave universal health coverage is talking about. Leave no one behind. Have you talking? If you don't answer me, I will stay there for 1 hour. Leave no one. That's what we're saying. Leave no one behind means leave no one behind. In documentation, in planning, leave no one behind. In everything that you do, leave no one behind. I'll give you another example. Can I see? There's another one in one of my communities. Alisa was pregnant. The husband's name is my community volunteer, Mohammed. And then I was monitoring the pregnancy to take her drugs because I didn't want stories. And then one day I called Mohammed Umar. Mohammed, how far with Alisa? How well, I don't care go health center. They don't come and say, "Babu game, begin no more come out." So they say make I can't go hospital say that operation. Back cow. They say back. What that didn't mean? Back. So when did this happen? He said 48 hours ago. I said, "Oh, but say she don't push. You know this. So she don't." He said make I go hospital. So where you there now? You dey house. You dey house. So she has been in labor for 48 hours. You dey house. He said, "Why back? Who did?" So in this particular case, who is in trouble?
The woman.
Then you say we should not call her out. Who call her out? The woman. I have never been. The funny thing about her own case was that I have never been so broke in my life. We were so broke. The bag at General Hospital, Guarimpa, was 35,000. That is operation bag. They have everything inside it. I didn't even have 35,000. It was on a Sunday. We rushed. Just go to Guarimpa. Just go. We rushed to Guarimpa. Got there. Confusion. Luckily for us, the man in charge of giving the bag, Umar is Fulani. So the man that is in charge of giving the bag is also Fulani. So Mohammed started speaking today to the man. So the man said, "But the point is who will pay. I had to now shorty." I didn't have the money notes. So I signed a shorty. I called the doctor. Doctor Offor. He said, "This one will die." I said, "Let her die." They had 9 months to plan. But he had 9 months to plan. He didn't plan for operation. And then, poverty is poverty. Poverty is poverty. And then they told us, we don't think baby will make it. Baby will not make it. We just want to save the life of the mother because it's too long. And guess what? They did the operation. The baby came out well. Alisa came out well.
Thank God.
It was a miracle. And the baby's name is also Muhammad Chika Umar. So what am I saying? Well, you get my drift.
Yeah.
So in the things that you do, I don't want to talk too much, but I don't have too much time. But can we just go to the slide? Look at infant mortality rates. Look at maternal rates. Can we go to the slide where we have? Look at extreme poverty. Extreme poverty is the problem. Let's not look at another problem. And that is what Basic Health Protection Fund and the insurance is trying to cater for. And when we are catering for this, don't forget the women. Call them out, mention them. What is due to them, give them. What they need help them. That's what I'm saying. And until they understand, we are all moved by the culture. I'm a Christian today because my parents were Christians. You are Muslim today because your parents were Muslims. And there's some cultural things that come with that. It's not your fault. So the way you think is different. You can't help it. We can't help it the way we think. So because of the way she thinks, should she suffer for it? Then because she says she does not want a man to touch her, should she suffer for it? Until she starts to understand something differently, she has a right to live. Please, I beg. Next slide, please. Let's just go to the one of legislation. They're not even here. So, okay, the claps are here. So, we have to transform primary health in everything that we do. What I'm begging is call out those things about women and children. See, they don't tell me 5 minutes. Are we sleeping? Okay now. Call out those things that pertain to women and children. They are important. Gender mainstreaming, in the things that you do, let the part about women and children come out. Look at Alisa. If nothing happened, Alisa would have died. And if Alisa died, it's Alisa that died. It's not Umar or Mohammed that died. Look at the other one, the two children who's in Anasana. Their mother is the one that has no children today, as far as you are speaking. The one has 28. So that's what we're saying. So, National Assembly, the parliamentarians, we are on our knees here. This is the area we want you to look at. Especially the states. For the insurance, how many for women, how many for men? You must disaggregate. All that story is a story for the gods. You must disaggregate. We must know, how does it affect women? These things, how does it affect women? These things, this insurance, how can women be a part of it? That is what we are saying. So the legislature, this is what we want. Adequate allocation, financial accountability, and all that. In one of our programs where we have adopt a facility, adopt a primary healthcare center, adopt a family. The first set of people that we brought to adopt because we wanted it to be successful were women, successful women, organizations. And we really explained to them, we didn't need to talk too much, really explained to them, they all adopted. And so coming to you in the FCT, we have a woman, a young girl, who is a business person, and what she's doing, she's repairing 5 roofs of some primary healthcare center because she wants to contribute. You don't need to talk too much, you don't have to convince them. They are mothers, or mothers in the making. Work with us as women, you will enjoy. Things will work faster and better. And that is what I am saying. So, strengthening the policies, the strategies, the plan, adequate budgetary allocation, enactment of evidence-based gender-responsive laws. We are looking now. We are looking at you. That is what we are saying. I don't want to give me 2 minutes left. I just want to say, call out women, check how it affects us. How we can benefit us, all those things will be put into consideration in everything that you do in the National Assembly. Oversight function for the parliamentarians, they should take it into consideration. Ask critical questions. Okay, in this health insurance, how many men, how many women? You understand? All those kind of things. In this facility, how many women are in the front line, nurses, shoes, all those kind of things. So that at the end of the day, universal health coverage will actually be universal. Thank you.